I guess we can start. So, good evening, all the delegates. I welcome you all to the panel discussion on research in surgery. Myself, Shirish Rao, Junior Research Executive at the Research Wing of Clinic SN. So, I'll be moderating today's panel discussion. And today on the panel, we have some eminent student researchers who would be sharing their research experiences and knowledge with us to help us know on like what is the scope of research in surgery and like how is it different, what is its importance, like what are the opportunities and much more. So to begin with, I would firstly like to introduce all the panelists. Firstly, we have with us Dr. Varun Bansal. He is currently an intern at St. James Medical College and KM Hospital, Mumbai. He is a member of Society of American GI and Endoscopic Surgeons, and also a part of Oncology Task Force for Gastroparesis Guideline Formation. He is an active national and international collaborator in multi-centric research projects with a keen interest in surgical oncology, trauma, and emergency surgery. Dr. Varun has also been recipients of multiple awards at various local, national, and international conferences, and has also been the recipient of the Metropolis MedEngage Research Scholarship. Secondly, we have with us Dr. Tanmay Jadhav, who is a FY2 trainee in anesthetics and interventional radiology in Manchester Hospital Trust in UK. He also works as a research assistant with a research-based NGO called Association for Socially Applicable Research. He has been actively involved as a co-investigator in 6 research projects and has been involved in multiple researches focusing on delivering surgical care in rural India and optimizing on healthcare policies regarding the same. Lastly, we have with us Dr. Sonika Sakhare, who is the junior resident at KIMS Hubli. She has been a co-investigator in 3 clinical research projects, and she has also acted as a mentor for the team which won the first prize in the recently concluded mentorship program and protocol presentation organized by Aspire X Cliniques as a part of Conference 2021 at KM Hospital. So with this brief introduction, I would like to give a brief flow of how the discussion will go about. I'll be addressing the questions to the panelists, and the questions would be open to any panelist to answer, and some of the questions might be addressed to a particular panelist as such. Audience are requested to kindly keep themselves on mute, and if they have any questions which need to be addressed to any of the panelists, kindly put them up in the chat box and I'll make sure I address them at the right point of time when that thing is being discussed, or I would like to take that question at the end. So with that brief introduction, let's not waste more time and start with the panel discussion. So to begin with, let's start with a very basic question as of key. In today's world, we are in the era of evidence-based medicine, and each and every field in medicine is currently in the need of generating more and more evidence and coming up with latest interventions, strategies, guidelines, assessing better risk factors for treating the diseases. So what importance does this research and evidence-based medicine hold in surgery, and like how is it different from the other conventional clinical research that we talk about? So any of the panelists can raise their hand or and like then unmute themselves and start. Any of the panelists would like to give their opinion on the same? Like what is the importance
Yeah.
of, yeah.
So basically, I personally feel that surgical research in itself is very underrepresented across the globe, not just in India. It's basically because I think that the culture which has grown is that medical research is the one which is more towards hardcore research, whereas surgery is more of something where it's more procedure or outcome driven research, which is like, okay, we've come up with this procedure, this is better than this procedure. So they will back it up with these number of cases, and they will say that okay, this is better, this should be implemented. And the problem is that all of this research is focused on tertiary care centers. And the problem with that is that only 5% of the entire population of the world has access to tertiary care centers for surgical care. Now, you understand how 90% of the surgical research is only implementing 5% of the world's population. Now, that is why increased research in surgery should also be promoted, because it should also drive the numbers for research into surgical care for the other 95% of the population. And I think that is where it can have a huge impact on studies into administration or workflows of surgery. uh, and this is the kind of research which even medical students and junior level doctors who are not surgeons can get involved in and make an actual impact into practice and the surgical literature out there. So I think that this is essentially why surgical research needs to be promoted, and particularly more into surgical research by junior level doctors, because the kind of research which they would choose would be something which is applicable more globally rather than super specialized research into a particular field which surgeons take up.
Okay, thank you so much, Tanmay, for the valuable insights. So on that note, considering the research that happens in tertiary care hospitals and the role of junior residents into them, I would like to invite Dr. Sonika ma'am and ask her to give her insights on like the research that Tanmay mentioned about that happens in tertiary care hospitals. Like, could you give us on more insights on like what kind of surgical research actually happens in like tertiary care hospitals, and like how does it take place, and like what are the roles of residents, doctors, like can medical students also participate in the same, and like yeah.
Okay. Yeah, as already been highlighted by Dr. Tanmay, the kind of research that happens in a tertiary care center is kind of, let's say, a little more advanced. Like, see, laparoscopic surgeries, for example, if we take conventional cholecystectomy versus laparoscopic cholecystectomy, or something like an open CBD exploration versus an ERCP or a lap CBD exploration. So we know that minimal access surgery is associated with a better outcome, early, discharge, and decreased hospital stay, and all these things are associated, or let's say things that favor minimal access surgery. And all of these have been possible, to be done in a tertiary care hospital, one where there is good facility. Okay, we need the instruments, which are pretty expensive. And see, surgical research is just that. Okay, you need resources. You can't just be like, I'll just go into the community and do a particular field study. It is not like that. You need certain instruments. You need, if you have to carry out certain procedure, you need the skills as well. You need the right people to do the right research. Okay, so that kind of limits, as Tanmay said, doing these things at a rural level or at a peripheral level. So all of these happens in a institute level, a tertiary care hospital, and implementation of that at a community level will become a little more difficult. And if you actually see, most of the surgical research that happens is from other countries. Okay, so they're going to say that let's say, for example, if it's CS stomach, okay, we do, let's say, gastrectomy, we do D1 or D2 lymphadenectomy, whatever be it, we do the surgical clearance. Following that, we need to somehow increase the survival. Okay, so there are different regimens that are followed for basically post-operative or the adjuvant chemotherapy. And a lot of this data comes from from the Western countries. Okay, what is good, or what is the ideal way of treating the post-operative patients in case of cancers. So all of that information is kind of suitable for the Western population. So Indian population differs from the Western population in a number of ways. Okay, so it could be the habitus, it could be our lifestyle, it could be the environment itself. So whatever they say might not be the right solution for the Indian population in the Indian subcontinent. So there is a need for a lot of research on our population, wherein we can implement these results on in our country and on our people. So there is a lot of scope for surgical research, I must say.
Okay, thank you so much, ma'am. So on that note, so let's get a bit more technical heavy. So we mentioned like researches go on in tertiary care hospitals. So now let's acquaint our delegates on like what kind of researches are this about. So I would like to invite Varun sir on giving an insights on like what kind of designs can surgical research be adopted upon, like from the basic ones to the most advanced ones, and like what is the scope of UG students to participate into like all of these designs, and like how to get into these projects and stuff.
Right. So that's actually a very big question, and I can go on to speak about it for days and days. I'll just split it
Okay, let's
into
keep it
various
concise on like
components. Yes.
the technical designs first, and then we
Right.
will go on to the opportunities later.
Right. Right. Okay. So I'll just break the question into parts and answer it. So the first being the kinds of research. All right. So broadly you can classify it into three types. So you have basic science, you have translational, and you have clinical research. So basic science research is what you would do in your labs day in and day out. Okay, it works with molecular mechanisms and genetics, for example. Okay, a lot of it. For example, I'm interested in oncology, so we have lots of work that would go on in, let's say, immune models and immune checkpoints in cancer therapy. Components that you would have heard about, but have not really explored it. Okay, because it is stuff that postdoctoral fellows and PhD students would do normally. All right. Translational research is a bridge between this basic science and the clinical research. I think I just got cut out. Am I audible now?
Yeah, Varun, you are audible now.
Yeah. Okay. So translational research is basically a bridge between the two. So you want to see how do the basic science components impact clinical practice. All right. So for example, if I'm looking for a mutation in a specific gene, all right, and I want to see what kind of treatment modalities can I use for it. I just want to see how would that really have an impact in the real domain. For example, if I just take out a cancer cell line, and if I see how, if I just administer an experimental drug, I would like to see what effect does it have and how it actually function inside the human body. That would be a short example regarding what translation research is about, and ultimately this is what will come into clinical practice when in terms of clinical research, all right, which can focus on various domains, including outcomes and quality of life. It can focus on health services and policy making, as Sanma was talking about. As undergraduate students, okay, I think this is what we are going to talk about most today. How can undergraduate students be involved in surgical research? You would mostly be doing clinical research at your respective institutes. We don't have a lot of places that do a lot of basic science and translation work, especially in India. All right, so within clinical research, again, briefly going over the designs, you have case reports, case series, case control studies for sectional studies, cohorts, which would be prospective or retrospective, randomized. I would always recommend starting with a case report. That is how even I started venturing into research, because it's something that's very easy to write. For scientific writing is all about. Hello.
Hello. Yeah, Varun would like to go ahead. Hello.
Yes, Shirish, I'll just join from another device because this one is cutting me in and out every 5 to 3
Okay,
minutes.
okay,
So
okay.
just give me 1 minute. I'll just join from another device.
Okay. So in the meantime, could Sonika ma'am give insights on like since like Varun sir told on like what kind of designs can be practiced by undergraduate students, and you had a recent experience with mentoring a bunch of undergraduate students for designing a study. So could you give insights on like how difficult is it for undergraduate students to understand this whole concept of research and especially integrate into a clinical subject which like they study in it only in the final year? So how do they bridge the literature gap as well as the technical aspects of research into it?
Okay. I myself did a project during my undergraduate days. That was the ICMR project. So from my personal experience, I would say it is pretty daunting and intimidating for an undergraduate student to, conceive the whole idea by themselves and have a plan laid out. And, it is a lot of work, and it might seem a little hard, but it's not like it cannot be done, or it's you need just help and guidance. The right kind of mentor, okay, will kind of help you get easy with the things. All you need to do is first decide as to what is the topic on which you're going to work. Okay, so and how do you get to decide on a topic? It's just that you go to your wards every day, you go to your surgical posting, which will start from your second year of MBBS. So when you go to the wards, you see what the postgraduates are doing, you see what the sisters are doing. When you take the case, when you talk to the patient, just you'll get to know a lot of questions that the postgraduates get faced in the around. So it's all about observation. So when you're in the ward, you're going to observe everything, and then you might find out a loophole, or you could be like, there's probably a better way of doing something. It could be a dressing, there could be SSI that you can notice in the ward, and the pain the patient is post-operative day 3 or 4, and he's supposed to get discharged, but then the patient ends up having fever and all the unnecessary symptoms, which will just delay his post-operative stay in the hospital. So it is all about observation. Then you will think of, okay, what could be the cause for this? So you go back home that day and you read up the literature, you read your standard textbooks, you could get references from your postgraduates. See, the most important thing is to get help, okay, when you're trying to proceed with your research. You can't say that, okay, I'll do everything on my own. That is not going to happen. And there are people who are probably in your college or in your circle who are more than ready to help you, okay, your seniors. So that way you come to a question, a research question. So you in and out, you just keep seeing things in your ward, and you'll find you will get onto a question. And that's how I think it'll all start. And if you don't think that topic is good enough, you can change, you can take some more time, and you can come up with a topic that you're actually interested in. And then take guidance from your seniors and postgraduates, or whoever it is, interns, and then you get on to a particular research, the resource that you can use to get more information regarding that particular topic. Probably go to your library, see the previous a review of literature and the review of articles that have been already been published on that topic, and that is how you will start your journey. And it is not hard at all. There are people who will be ready to help you. Just you need to find the right person. That's it.
Yeah, that's exactly what he wanted to hear from a mentor. So on that note, so since we have two of the students who are like recently out of their undergraduation and have done a lot of research in their undergraduations, I would like to request Tanmay and Varun to share a few insights on like how was their research journey during their undergraduation. What are the hurdles did they face? What were the learnings from them? Like what was the take-home messages? What were the implications? Like starting from Tanmay first.
Oh, okay. So I guess I kind of tried to start research in second first, because I just wanted to like know what research is, why is everybody doing USMLE, crazy with it. So I went up with a topic. I had a topic in mind. I went to the ethics committee in KEM, and they were like, minimum 6 mahina lagega. I'm like, I cannot do this. Like I personally hate the unnecessary paperwork which comes with ethic clearance in KEM particularly. So I'm like, I just want to do research, right? I'm not, I know by my own conscience that I'm not harming anybody. So I would like a straightforward ethics clearance, and that's not what I was getting in KEM. So I shifted my entire focus of doing research to Vardia, which has a much straightforward process, and consultants who are much more willing and have much more experience in formal, substantial research. So I approached one of the consultants in neuropediatrics who I knew through a friend. And she's like, yeah, sure, if that's your idea, we have the equipment and you can go ahead with it. And lucky enough, I was able to get the experience in the first meeting itself. Unfortunately, I do not have experience in poster presentations. So in case reports and stuff. So I'm probably going to have to take lessons from Varun about that. Anyways, so my experience started off with working with people who were at an international level in research, particularly. So I started off with neuropediatrics as a research, and then later on went on to more invasive procedure where we were doing EEGs for the same research as a follow-up to see sleeping disorders in children with cerebral palsy. So that was essentially, I just wanted to know what research was. And then eventually it kind of segued into something which actually does help with your CV, stuff like that. So I think everybody in their undergraduate should experiment with research. For myself, I know that clinical research is not for me. I do not enjoy clinical research at all. So doing it, I think it's not everybody's piece of cake, right? You need to try it out once or twice to understand if that's something you actually want to do. Because quite often, you're forced into it because of career decisions, and you just don't enjoy it. And you should not do it because you don't just for the CV, because it takes time, it takes effort. You really need to love it to actually want to keep doing the statistics aspect of it, to plan the study. It's not something which comes easy. It's not something like an exam which you can see other uses for your knowledge. So I think everybody should give a basic research a try in undergraduation, see if it's for them or not. I did not pick up more researches after that. It was a very successful research project, although the one that I did, we presented at an international conference, got awarded and stuff like that. But I did not take up any other research projects after that because of me being averse to clinical research after that. But then I came across this whole concept of socially impactable research, research which is geared towards policy making, which does not require you to go to the hospital and particularly like Varun said, clinical research is what undergraduate students usually take up, and you need to go to the hospital, you need to look at these cases, get this data. Now the problem with that is that, one, you need to really bridge that knowledge gap, particularly if you're an undergraduate student. You need a mentor for that, like Dr. Sonika said. And two is that you might end up looking like, sometimes when you start research with a general idea, you kind of start looking for, can this be a significant p value? Can this be a significant p value? So you quite often you segue into a very gray area of research where you're just trying to bring something out of the study that you've done. So when I found out the socially impactable research, where the data is already available, the government has a bunch of data which it publishes. Quite often, it just needs cleaning and a different perspective on it to kind of put together multiple pieces of puzzle and just say, look, this is what we've found. This is the data which you have. So you've accepted it. The government has accepted this is the data. So we've just put this data together. We've analyzed it and we say that this is what you should be doing. And probably that at some point in the future, if that helps the government formulate policies, it impacts the life of an entire nation rather than a particular subset of people undergoing cholecystectomies. And again, sorry, there's just one last point I want to mention is that the thing with clinical research is that if you want to make a huge impact, quite often the thing is that when it comes to surgery, right? I might have a very skeptical opinion, but I personally feel that when it comes to surgery, to actually produce significant path-changing or policy-changing research in surgery, there is a necessity for extreme amount of, not extreme, like at least a significant amount of funding, where you can actually go into the current, adhere to current policies and check that against the procedures which are being done. And unfortunately, most government colleges in India do not have that kind of infrastructure or funding to go about it. So quite often you would end up with a paper which isn't exactly up to the standards of Lancet or stuff like that. And that is why you probably don't see most of your professors' papers being published in big journals. So that is definitely a limitation which you need to consider. Maybe that's just me being a pessimist, but I really hope we can change that over the next few years with more funding, maybe from private players, now that people have been starting to come with innovative ways of funding. So I think there's a huge opportunity for people who want to get into research, and medical students should give it a try at least once.
Yeah, thank you so much, Tanmay. That really gave up a very wide perspective on like how can a UG student approach research, right from the primary to the secondary literature and much more. So now I'd like to invite back Varun and get more insights from starting with the basic research, that is from the case report to going on to the highest form of research to like randomized control trials and multi-centric collaborative projects. So how was your journey through all of those? And like what would be your advice for most students to get into these kind of projects and like get an experience of that?
All right. So I started off in my first year when I joined the medical symposium team for our college, and the awareness and attitudes about clinical hypnosis because that is what our symposium presentation was based on. We were planning to later and publish the results of a survey, but my team broke down right somewhere in the second year, and I picked it up again in my third minor. Okay, when I realized that I want to really do this, I had the results in hand, and I just need to write it up. All right, so that is when I wrote my first original article, which we published in the Indian Journal of Mental Health last year. And again in my third minor is when I really ventured into research significantly because I approached one of my professors in general surgery, and I said that I would just want to work on a project. All right, and this mentor, he actually turned out to be one of the strongest supporting influences I've ever had, because he asked me a very important question. He asked me, "What do you expect?" And that is what I believe that most medical students we forget us thinking about, is that what do we want to get out of it, and what do we really want. So if you would just go up to your faculty and say that I want to participate in research, I really don't think that is an adequate approach, because you really want to impress your faculty when you're going up to them and saying that you're interested, because only when you show them that you're interested would they be willing to offer you something. All right, most students, they will begin usually with a project in the paraclinical department. That's at least that's how we usually do it at KEM. All right, so somewhere in second year is when students, they would be interested and they'll be like, let's venture into pharmacology, microbiology, or pathology. All right, and these departments are pretty active at KEM, for example. All right, so that is where they would get their first research experience, and then later on, if they're interested further, they would venture into the clinical departments, including medicine, surgery, pediatrics, and OBGYN. Not OBGYN that much, but the rest, yes, they do. All right, so that is what the usual trajectory that students would take up would be like. Continuing further with my journey, all right, so I started working on a prospective cohort study, which was one of the thesis projects for one of our general surgery residents regarding the outcomes following different antibiotic prophylaxis in patients undergoing elective ventral hernia repairs. And I was actively involved in the process of enrolling patients. I was taking consent, noting the baseline particulars, and following up with them to note whether they have developed any surgical site infections or any other postoperative complications. We were going at a good pace, but unfortunately, our study came to a pause during COVID, because of which we lost greatly in numbers. And since then, also we haven't been able to recruit a lot because of not although our elective operations, they have resumed, but at a greatly reduced rate. All right, so it suffered because of that. But I learned so much because I was involved right from the process of enrolling patients. All right, so I myself enrolled more than 60 patients in that, and it has led to a lot, which I will speak about subsequently. All right, I enrolled so many patients. I was actively involved in, after collecting the data, I also had to analyze it, and I presented the interim results of our study at a national surgical conference, for which I won an award too. It helped me with. So this one prospective cohort study that I participated in, which is still going on, it's been more than 2 years, it led to the following. It made me a lot more confident in clinical research to the extent that I can independently go up to a patient and I can tell them, yes, I want to recruit you for the study, and I can explain them the whole consent process, and I'm really confident with it. And till date, I've enrolled more than 100 patients in various surgical projects that I have done at KEM. All right, it gave me the confidence to speak to mentors, to present at conferences, and really become in a position that I can demand, I can exactly ask, what do I want? So if subsequently I would go to a mentor and ask that I want I want a project, and they would ask me, what exactly are you looking for? Then I would be able to say that this is the duration that I'm looking for, this is the study design I'm interested in, these are the fields that I am interested in. For example, I've done a lot of work in abdominal wall reconstruction, including inguinal and ventral hernia repair. So the next time I went to my mentor, I said I preferably don't want something in that. I'm working on trauma and emergency general surgery. I've never really dived into that, so it would be something I want to explore. and I would ultimately want to be a part of the analysis, present it at the conference, and then publish it. So this is what I approached my mentor with subsequently. He eventually offered me the opportunity to participate on a pilot study for a randomized controlled trial regarding the outcomes for following training in trauma management, including the ATLS and the PTC. I won't go into the details of which. So we are still in the process of getting our ethical approval for that. Other than that, the other projects that I later ventured into during my final year, they included the following. So I work on a lot of cohort studies. So there was one more regarding eventual hernia repair. Then I worked on a couple of international collaborations. So Sharif has been working with me on one regarding pediatric cancers and how did the management change during COVID. I am working on one regarding the outcomes following pancreatic surgery, regarding urinary retention following inguinal hernia repair, and the outcomes following traumatic brain injury. And these are all multi-centric international collaborations being conducted by major bodies in the US and the UK. So these are some of the cohort studies that I've been a part of. I also approached a mentor at the Tata Memorial Cancer, saying that I'm interested in oncology, but we do not have a dedicated oncology facility at our center. So I would be grateful if you could give me an opportunity to let me be a part of a randomized controlled trial. I just went up front and I said that I really want the experience, and they were happy to have me on because I was very interested. I haven't been able to work on it yet because of COVID-related entry restrictions at the Tata Memorial Cancer Center, but hopefully before I graduate, I look forward to working over there. I eventually began networking with surgeons across India and across the world. Subsequently, towards the end of my final year and during my internship, it gave me the opportunity to collaborate with an international body, the Society of American GI and Endoscopic Surgeons, the SAGES. All right. So with them, I received training in systematic review and meta-analysis methodologies, following which I joined the gastroparesis guidelines group. So now all these major bodies, you would know, for example, the American College of Cardiology, that will come up with guidelines for hypertension or for cardiovascular disease. All right, so these major bodies, they come up with the guidelines. Similarly, SAGES is a pioneer in GI and endoscopic surgery, and many of their guidelines are highly looked upon and followed across the world. So and to frame these guidelines, they have to review a large amount of literature, okay, span all over the world to ultimately give the recommendations. So I am a part of one of the guideline groups regarding gastroparesis. I have also been given the opportunity to serve on the oncology task force committee for the coming academic year with SAGES. So I'm working on two of the committees. I am also collaborating with a trauma research group based in India and some members in Sweden and the US and Japan and various other places. We've got a really active group which actually conducted two of the largest multi-centric cohort studies to make a database, a trauma registry, which resulted in many papers. I am deviating. Sorry, I was just talking about my experience. I'm sorry, I just got carried away.
Yeah, like we can now wrap up on the end part of it now.
Yes. All right. I'm sorry. I just got carried away.
No, this was exactly what was needed.
So, yes,
we can just wrap it up now.
The moral being that the basic starting point for me in surgical research was one prospective cohort study, right? And it led to so much more. Coming back to the question that Shirish asked about how can you go about pursuing research in your undergraduate time, it would be start approaching your mentors. I absolutely agree with what Dr. Sonika and what Tanmay spoke about, especially regarding mentorship. Okay, that you should just try to approach your mentors. I personally believe it to be very important because as medical students, we really are not in a position to ask clinically relevant questions. All right, and that is something that you will become more well versed with as a resident. All right, or as a faculty member. So you can just tag along with the projects, all right, and just gain as much experience as you want, because this experience, it's going to serve as a pedestal for you to conduct more meaningful research and to have projects under your belt which will have much more impact in the future, in the coming years. All right, and having that background during your MBBS time, it is something that is very useful and most students lack currently. Shirish, are there any other aspects of the question that you need me to answer?
Like, yeah, that perfectly summed up
Could I
what
could
was
I just
required.
add one more
Yeah,
thing?
Tanmay. Yeah,
So
Tanmay, surely.
I think quite a few people, that they don't really want to get into the entire research full head on. So I have a small trick for you, which you can use for like getting into research per se. So there's a lot of residents out there. Every resident has to do the thesis, okay? So if you know quite a few residents, quite often they just do the thesis, they don't publish it. So if you know a resident, because the thesis is like huge, I think it's 100 pages, something like that. So if you know a few residents, just see what topics they have taken. Do a bit of background reading. They've also probably done background reading. If you feel like this is a clinical question or something which does not have enough literature on it, you can actually you can offer the resident to convert their thesis into a paper and submit. So that gives you experience in paper writing. And through the process of paper writing, you're also learning how they have implemented the research. And it's kind of being part of the research by proxy. So it's like an indirect way of understanding research, and you also get a paper to your name. So since you've co-written it, so I think that's a sort of nifty hack if you want something against your name, plus you want to just get into research by proxy.
Tanmay, actually, I'd like to comment about that. Shirish, do I have a little more time?
Yeah, you may go ahead.
Yes, all right. So actually, this is something that I was very keen on, and my mentors were also. And as in Aspire, we were really promoting this to have students join thesis projects. But recently at KEM, there has been a ban on having undergraduate students work on any thesis project. So it's really unfortunate, but yes, that is the case. And at KEM, you will absolutely not have an opportunity to do that. I was hoping to have two more medical students work with me on the Hernia project, and it was rejected outrightly by all three ethics committees. All right, so that is
So
something that
I think there's a slight difference between what I think you're suggesting and what I'm suggesting. Basically, what I'm saying is that once they've completed, so people who have completed their MD degrees were in MCH. So when they wrote the thesis for the MD, that thesis is complete. So that you're not involved in the research for submission for thesis. You would be involved in writing the paper for submission to a journal, which the ethics has already it does not come into question because they have already gotten the clearance, they've completed the thesis. So I think that ban does not apply to the situation which I think I was suggesting.
yes, I
But
agree.
I
All right,
doubt
but
how many of the residents would be okay with that, because they would have done their ass off. They would have watched
Surprisingly a lot. Surprisingly a
I,
lot.
I doubt it, but I mean, not most of the residents will be open to that. I agree that they do their thesis and then after that they don't follow it up. It's just to get their degree and they get out of the university. I agree with that, but yeah, maybe they could try this.
and
Okay.
to add on, I just don't want to offend anyone regarding this, but in my knowledge, what I have seen is that many of the residents, right, when they're working on the thesis projects, it is not out of interest and it's more of compulsion that you get a degree. We have to do the thesis. So that way, the quality of the data collection, it really deteriorates, all right?
Absolutely.
And yeah, because of that, even though if you have a data set to work with, which resulted from a residence thesis, it really might not have been the best. It might not have been conducted in the best way. So that way, it might not be the best. Might not be a very good learning experience. And that way, working on PI initiated projects is a much more fruitful, although it's a more time-consuming experience. In the long run, it is definitely going to benefit you a lot. Definitely ask your faculty regarding any existing data sets that they already have, which they might want you to work with. It is a shorter experience and it gives you a lot of experience and a lot of it will give actually it takes a little less effort, but you get to learn a lot about analysis, paper writing, and getting into multiple rounds of reviews, which is again a very important component of research in general. So I do agree with this.
Yeah. Okay. So thank you so much, Tanmay and Varun, for sharing the complete first person point of perspective of an undergraduate from thinking of a research question, thinking of like, should I pursue research or not? Then starting from right from the basic kind of studies, from case reports, then like climbing up on the ladder of evidence-based medicine to like reaching cohort studies to clinical trials to then like systematic reviews. Like this has all been like the delegates. I would like tell like you must understand that this is a thing that has come out of perseverance and complete passion of these panelists who have put in their work into it, and the passion towards the subject as well as the work they are putting into. Like none of us were actually acquainted to research, and like no one came up to us and told you have to do it, you have to learn it, you have to put in so much of time into it. It was all out of interest and curiosity and the quest of doing something more than just academics and like rising above the normal. So this adds so much more of a lateral perspective, lateral learning, builds such a huge amount of network. Like you must have seen from like how Varun went from a simple case report to collaborating with multiple international studies as well as like multiple international societies and clinical trials. Like this builds up networking to a huge extent. So to that, like there is a lot of learning from you can take up from the UG journeys of both Tanmay and Varun. And like now to transit to how it goes after UG, I would like to ask Sonika ma'am a few questions from a surgeon's perspective, as well as like from a resident, as well as from a complete surgeon's perspective. As like previously mentioned, like residency is already very hectic, and we usually get a very less amount of time to pursue research, and like even thesis itself is perceived as a very less
True
important
that.
thing. And apart from that, like clinicians, like particularly surgeons, I believe that they depend more on like experience based and their own experience based practices rather than like following something which is being studied abroad. As you said, very
True that.
less indigenous research is done inside. So like how can we fill up this lacunae in the core clinical practice of surgeons, and like what is the role of residents, what is the role of like consultant surgical doctors, and like in super specialties, etc. Like how can this gap be bridged, and like how can this entire concept of evidence-based medicine be integrated into surgical care?
Okay. Once you're out of your undergraduation and then you become a resident, there seems to be a lot of responsibility on you. It's like if you take your residency in a government college, it's like you are totally in charge of the patients in your ward. So there is already less time for academics, as Shiri's already pointed out, and there's even more less time to go ahead with your thesis or your research or anything that you want to do out of interest. So that is a very valid point. And especially when it comes to surgery, the amount of ward work and the amount of work that a resident has to do is tremendous. Okay, at the end of the day, if you're a first year resident, you hardly get any time to even like wash up your face or take bath. I had really busy days. I should take bath once in 3 days. It was horrible that way. So balancing.
Sleep.
True
You
that.
don't get time to sleep.
Yeah, true that. No sleep at all. So with all of that, keeping up the interest to do research is a big thing. And then what usually happens, this is the usual story. What happens is when you come into your third year of residency, you're doing, you're assisting your boss for super major cases. You're getting to do your, minor cases like hernia, appendix on your own. You're doing your INDs. And then you have the last 6 months for the exam to go, and you start cramming up to study. And that's when you think of your thesis. It's like, okay, the university says this is the last date, you need to submit it. And then that's when you start, oh, okay, I need to start writing my part A. So, that is how things are. But if you be more, planned, and if you really like research, and it's always better to start in an earlier stage. That way, as the panelists have already, made it a point that yes, the kind of data that comes out of the thesis work from a resident, they are not that valid. So in the end, people end up tweaking the data here and there to make it more significant and just to get out a proper result. So that happens, but unfortunate. It's not supposed to happen that way. So that's that. And as Sirish pointed out, that there are surgeons. Okay, once you get into surgery, and it's all about technique and it's about skill. So if you're doing a particular procedure a particular way that you've learned, see, I learned from my boss. So there is for a particular surgery, there are multiple ways of approaching it. So you could probably split the muscle, somebody might cut it, somebody might use bipolar instead of more. See, it's like you see your surgeon, your boss, and you learn from him, which is very different from what a postgraduate from the second unit will learn from his boss. So there are a number of variations. There is no standardized data. And if there is a standardized data and you say, okay, this is what is recommended, and then my boss is going to say, no, I get better results with this technique. My patients get well better. So they get discharged earlier. Why should I follow some other technique? So yes, there is a lot of discrepancy this way. Ultimately, it comes to the surgeon who is performing the surgery and what he is comfortable with. But still, the residents are doing a lot of research, trying to find out the gaps in the study, in the knowledge that already exists. And there's a lot of scope for undergraduates to be involved in it as well. And one more point I want to highlight here is, if you are getting into research, like if this is your first project, or you're getting into the field of research which you're not been exposed to before, I think the best way to do that would be involved in an audit. So audit is not a research, that's true, but when you get into be a part of the audit team, so you will get to know how exactly a clinical audit, especially in surgery, it's completely clinical. Okay, so you will get to know how an audit is done, how the data collection happens, and how are you going to really bring about a change. It doesn't give you information about how to analyze and all that. It just gives you an idea as to how to carry out the research. Okay, so you will get a lot of experience with that, and you will get to know whether research is for you or not, whether you are interested in engaging in further research activities or not. So it just gives you a highlight. If you don't like it, you could probably come up with some changes so that you will end up liking it. Or if you really like an audit, then it's pretty much certain that you will like research. Then you could really go ahead with bigger projects.
Yeah, thank you so much, ma'am, for providing such like ground level perspectives on what really goes on, and like how things can be improvised and improved and things can be carried forward ahead. I think Tanmay has first-hand experiences doing quite a lot of audits, so he can give
I think
insights on that.
Shirish understood the palpable excitement the minute Dr. Sonika said audits.
Yeah, so you may go ahead regarding that, and you may also address on like a few students had asked like how much of importance does research and publications hold in like going for UK and US, etc. for
Right. So
lab and
since
all.
we're on the topic, I might as well
Yeah,
just
you may address
yeah.
like how valuable is like audits in giving points. Like as far as I know, it's the highest. So you
Exactly.
can
So
you can give insights on that.
Simply put, if I had to tell you that your portfolio, which is the word for CV in the UK, your portfolio has certain points associated with it. So the higher you score on your portfolio, the better your CV is. That's a very objective way of looking at it. It's not subjective. So if you do a leading research, which Varun is probably involved in, one of the researches which is multi-centric, all of that gets published in a trade journal, you're the first author, everything, you presented at an international conference, and you do one simple audit full cycle in KEM hospital, you will get the same amount of points on your portfolio. The world is moving towards audits and QIPs. The Western world particularly is starting to realize that not everybody wants to do research and not everybody should be forced to do research. Instead of that, what the point of research was that every doctor should contribute towards improving patient outcomes and quality of patient care. And an audit is a very easy and realistic way of expecting that from a doctor rather than a research. So in an audit can be simple. You have policies which say that the national guideline says that post appendectomy infection should be less than 5% in the UK. And you would just go about 1 month's data of people who've had, by the way, I'm making this data up, I'm just for an example, you just go about collecting 1 month of data for people who have had an appendectomy, and you would see how many of them got an infection after the appendectomy. And if it is below 5%, you've proven that the current patient care in your hospital is adequate. if you say that it's 7%, you would then go on to see why is it 7%? Is the intraoperative antibiotics not being given on time? Is the post-operative wound care not adequate? Is the patient not being hydrated enough? Are diabetic patients getting it more? Whatever the factors can be, you look at them and you identify, acha, theek hai, this is where we're not giving gentamicin to the adequate doses, say, for example. And then you would implement, like, say, for example, you put up a poster, you do a theater, revival course, which educates surgeons and anesthetists that you have to give this antibiotic at this particular time, and for this dosage, taking into consideration kidney function, stuff like that, which you can do in a matter of 1 to 2 weeks. And then you re-audit the next month and you see, acha, okay, now the rate has come down to 5.5 from 7, which means that you have shown improvement. You have improved the patient care delivery in your hospital, which becomes a full cycle audit. And since you have improved patient outcomes as well, it becomes a quality improvement project, which has the highest amount of marks in your portfolio for the UK. So it is something very simple. I struggled to find. I was actually very pleasantly surprised when Dr. Sonika said that there are audits which are done in her hospital, because I struggled to find people who even understood what an audit is in KEM. And eventually, during the last few months of my internship, I approached one of the big names in pediatric cardiology in Wadia, and I'm like, I need to do an audit, but I can't find somebody to do an audit. And she's like, look, I've just set up an audit department 1 month ago in that hospital. So go crazy. So I went about, I did like 2-3 audits in a month of, in a matter of 1 month, presented them, completed the cycle, implemented change, showed positive outcome for patient care. And I got my points before even coming to the UK. So I think audits is something which you don't need ethics clearance for, by the way. Unless you're taking direct patient data. I mean, as in if you're looking at directly taking some data from the patient. If the data is already on your system or in your paperwork, you do not need ethics clearance. You just need an approval letter from the person you're going to be accessing the data from. So that cuts out a huge amount of time. So you can literally do 1 audit per month and you can keep doing the cycle. And I think that is a very excellent starting point for you to see if you are interested in research, or even if you dedicate your entire life to audits, there are people who do that. Just a small, so definitely approach people and tell them, look, we're going to do an audit. Don't worry, I know what to do. I have searched Google and stuff like that. I have templates. You just be the name who's behind this, and we will present it as. So find a consultant like that who's open-minded and open to these ideas. One last thing, I think somebody asked a question about research for UK portfolios. Essentially, yes, research is important because it's sort of starting to become a differentiating factor. There's a lot of new people coming to the UK, so the competition has increased, and that's why staying ahead of the curve has made it essential. Before, it was not essential to have a research to get in training, but now at least one research you should have in a peer-reviewed PubMed index journal. So that's why I suggest that you get at least one under your belt. So anyway, you need to understand if you want to do it or not, but you get one, you get into training, and then even if you don't do a research for the rest of your life, it's okay in the UK, because they value audits over research, unlike the US. So you just need to get into research to get into training. That's it. So I just say, just get 1 or 2 done and forget about it if you don't like it. Thanks.
Okay, that was indeed a highly technical and highly informative session about audits as well. So hands were raised by both Varun sir as well as Sonika ma'am. So I would just like to ask both of you what do you guys want to address upon? Because we have half an hour left, and I want to address upon 2 other things, like the rural surgical aspect, global surgery, and evidence-based surgery among surgeons. So these are the 3 topics that I wanted to address. So if it's related to any of those, or if it's any small comment, you may go ahead and address that, or we may go ahead and address the bigger topics.
A small comment from my
Yeah.
end. So firstly, I would definitely agree regarding resident involvement in surgery, all right, because as Dr. Sonika shared, all right, that these are the procedures that they're doing day in and day out, and that's why they come up with the questions. All right, so good quality research, good quality questions only come up when you are practicing something day in and day out. Okay, you wouldn't have someone working in a lab, okay, perform meaningful research about surgical outcome and surgical care It is going to be a surgeon who is performing that surgery 5 or 6 times a day, all right, for years and years to come, who would actually be more proficient at it. And secondly, I definitely agree that audits are very good learning tools because they give you first-hand experience with patient exposure, all right, at a very young age, all right. So it is something that you should definitely look into if you have the chance.
Yeah, thank you, Varun. Yeah, Sonika ma'am, would you like to comment upon anything?
Yeah, it was about the portfolio that that you prepare for your after your PLAB or maybe after your MRCS. So research, yes, you do get extra points for having research done. If not, just don't worry about it. Okay, there are people who say you should have done research and they really stress about it. As it has been pointed out, you do 1 or 2 audits, that would be good enough. You don't have to worry too much about research if you are planning to have a good portfolio. That's one thing I wanted to say. And second is, when you're planning to do an audit, you need to get the standardized data for that particular region, and so that you compare your hospital data with that standards. And unfortunately in India we don't have standardized data for everything. So in the UK there's something called the NICE guidelines. You have NICE guidelines for everything, for almost everything and anything in the UK. So in India we need to just find out what is the standardized data, and then go ahead with your audit. That's one thing I wanted to add.
Sorry, I'm just going to add one small comment as well. So people who want to do surgery, who want to come to the UK and do surgery, I don't want to have a conflict of interest here, but I'm just saying that because of the increased competition, research is becoming necessary if you want to start from ST1. Because if you come through the MRCS pathway, then you technically have a slight background in surgery, and they look at that as well. But having one research is becoming more and more essential. And secondly, it's much easier to get research done and get a publication if you're in India compared to the UK. I'd say that get one research under your belt from India itself. Don't wait to come to the UK, because that would take time.
I agree with Tanmay, but one thing is, if you have decided to be a surgeon and if you want to go ahead and get your training done in the UK, the best thing to do is to finish your post graduation in India. Go after finishing your MRCS, go as ST.
We'd have difference of opinion on this. We'd have difference.
No, if you want to be a surgeon, I think this is the best pathway that there is.
No. I agree. I agree with the number.
Maybe we can discuss upon that a bit
yeah,
later.
maybe, but because you save a lot of time and you have a lot of experience that you get in India, because you get free hand.
Let's come upon global surgery. Now let's come upon global surgery.
This would be a different session altogether. Sorry.
Yeah. So coming up to global surgery, what I wanted to address is as every panelist have pointed out that there is very much of scarcity of indigenous groundwork or the quality research that goes on in India. So a lot of global surgery groups that have come up, and a lot of research goes upon in the West, but they collaborate a lot with the low middle income countries as well as do multi-centric collaborative studies to gather data and all. So what is the role of this global surgery groups and global commissions, like Lancet Global Commission or SAGES, etc.? What role do they play in shaping up evidence-based medicine in surgery? And again, to a point that was actually I felt was missed out, how do surgeons actually bring about evidence-based practice in their actual practice? As Sonika ma'am said, the procedures are so subjective and different to the mentor you are learning under. So where is the thing that you say ki, okay, this is where I am sticking to the evidence and this is where I am sticking to my practice that my surgeon is saying? So this question is open to all the panelists. I would like to have all the panelists answer upon that, and we can have around 7 to 10 minute discussion on it. Yeah, Sonika ma'am can go ahead.
Yeah, there are, we do have CMEs, we do have journal clubs, we have recent advances. So there are, meetings like this where we call upon the most successful surgeons in the particular field. And then we postgraduates ask them a lot of questions, and they tell us what is the most recent technique that has been, followed for a particular surgery, let's say. So there is a lot of discussion that happens among this postgraduate students, the staff. So it is like, CMEs like this, which really tell us, that's how at least we get to know about what are the most recent updates in a particular procedure or treating a particular disease. So that's how we get to know. And following that in our clinical practice is, I think, yet a question mark. I think there are surgeons who do that. They are exceptionally good. So if your boss does it, you're too lucky. Otherwise, you just learn from, attend the CMEs, make a note of it. And once you become a surgeon, you implement those. And I think by that time, we'll have newer guidelines, but still just keep up to date with the information that is there. Subscribe to the journals, and keep updating yourself with the recent data. That is important.
Okay, yeah, that was indeed insightful. Like Varun, would you like to tell us more on like how do this global research groups function, and two things on this. Okay, like how much do they contribute? Like what is their role in this complete surgical evidence? And the other is like kind of building an network into this network groups, and like getting into this kind of projects like right from the undergraduate itself. Like what is your opinion on that?
Okay, Shirish, I would need to clarify a few things already.
Okay.
So first is regarding global surgery and rural research. Second is about surgical societies and surgical groups, and the third would be about networking. All right.
Yeah.
So let's start with global surgery. All right. So it is primarily based on the delivery of surgical care in low-income setups. All right. Okay. With a lot of the activities based in even in Asia and in Africa and in South America, for example. All right. So there are certain groups which are actively involved in global surgery. For example, the Lancet Health Commission that you spoke about, okay, the Lancet Surgery Commission, all right. And I'm lucky to have had the opportunity to work with the ex-Lancet Commissioner for global surgery in India on one of the trauma projects that I was working on. All right, you guys can just go through it. I'll send the link on the group on this chat, okay, and you can read about it later. So it is definitely an interesting aspect. I have not had a lot of experience with it, hence I won't comment about it. The second is regarding surgical societies and surgical bodies. All right, so there are plenty of societies with respect to whatever region or whatever specialty you are looking into. All right, so to keep it simple, give a simple example. Okay, for a non-surgical field, you might have heard of, let's say, the American College of Physicians or the American College of Cardiology. All right. Similarly, for surgery, we have various bodies. For example, the American College of Surgeons, SAGES, which I told you about, the Association of Academic Surgery, which is regarding primarily about surgical education and I think the academic component of surgery. All right. You can easily just apply for the memberships. All right. Many of these are free. Some of them would require to subscribe at a nominal cost. The costs are much less for medical students and slightly higher for residents. All right. And they tend to have a lot of opportunities for you to become involved. Okay, so they are looking to actively involve medical students in many of their activities. You just have to keep looking for the opportunities on their websites and the emails that they will send out. Okay, and you might just see that, okay, I have a chance to do this. For example, the American College of Surgeons, it has various communities, one of it being a medical student community, where they will just send out updates and invites for various things. For example, there was a few months ago, there was an invite for authors to work on a book, okay, to contribute chapters to a book regarding translational research. And I ended up writing 3 chapters for that book, which is still under review. All right. And similarly, you will have many opportunities which you get come across to get involved in these. They help you network definitely, but it is not only about networking, but again, it's more about a learning experience. That comes out of it, okay, which is equally important. We can talk about networking as a separate question, I believe, all right. And the last Shirish, the last component was regarding how do these translate into clinical practice. Is that right?
No, like how like net you can comment upon networking and like getting into this project.
Okay, getting into this, right? All right. So I said that these you can look on the websites and you can look into the emails and the newsletters that they send you, and about how to get involved. Okay, so you have activities which might be directly pertaining to surgical bodies and surgical communities. And the second thing which you would be more interested in me speaking about would be these multi-centric international collaborations. All right. So I've already spoken about the first part. I'll speak about the collaborative projects. Okay. So the thing is that many bodies, all right, many institutes, the major ones being based in the US and UK, they tend to design projects which tend to involve collecting data from various countries and various centers all over the world. Okay, because they like to work with large data sets to come up with uh, information that is but that is applicable in low, middle, and high income setups. All right. So these guys, what they would do is that they would design the protocols, the case record forms, and all the paperwork that you require. Okay. So as compared to working on an original project, okay, they are giving you 75% of the work because they have everything ready. Oh, okay. And all you have to do is submit the exact same protocol and the case record forms and the other documents. You might have to translate it in your own language, but many of these they have the translations ready. All right, you just have to submit it to your ethics committee as it is. All right, and you have to request for the approval. All right. The one additional component comes into it is getting the approval of the Health Ministry Screening Committee, known as the HMSC. All right. To carry out any international collaborative project in India, you need the approval from this body, and it will usually be a national lead who will do that. There'll be many centers within India, for example, that will be working on one project. All right. One of the centers will take up the role of a national lead, and they will help you coordinate with this and other stuff. All right. Once you get the approval, you just have to collect the data as it is that they have asked you. All right. Fill the case record forms and send it to them. They are going to analyze it. They are going to publish the results, and your name would come up as a co-author on every manuscript that results from that collaboration. All right. So this they and how where are these studies advertised? Went to a large extent on social media. Okay, Twitter and LinkedIn. Okay, you can try following major surgical groups and surgical bodies and surgeons for that matter who are actively involved in that field. Okay, and you might come across these opportunities. Yeah.
Yeah. Thank you so much, Varun, for that insightful discussion. I'm sure like delegates must have learned a lot on like how you can develop such kind of projects. From a personal note, I would say to get mentors outside your college, because like on a personal note, like not every college is blessed with professors who are like very much interested in research or like very much experts. So just go into go on to ResearchGate, go on to LinkedIn, go on to multiple like these organizations websites and all, and you will find professors and consultants who are like very much involved into research, and just start sending them cold emails like you are interested in pursuing this with them, or you are interested in collaborating with them. Like give your motivation on working with them, and like they will try to collaborate with you and like try to work with you, try to get in touch with more students who are like working into this kind of field, or like who are into research and all. Then they will help you a lot. So to wind up with, to the last and the most which like even I feel is like very much important, is surgical care delivery in rural India, and like how can this entire surgical care be integrated into policy making and like actually made socially applicable and make relevance into the audience, like the majority of the crowd of India, and how can all of this be optimized, and what role can we play into that? I would like to request Tanmay to take the stage and speak about it.
Thank you. So I think Shirish has become really interested in this field recently. When he's discovered this, he's going. I think he's going to abandon clinical research after he gets into this. So basically, the problem with rural India is that it's ignored. It's literally ignored. So the problem is that we're not conducting enough research into how we're delivering surgical care in India. To an extent, we have research in primary care because that is what the government has been focusing on in rural India. It's like what population sizes should be per PHC, per CHC, stuff like that, which is evidence based. Now the problem is that there was this commission called Lancet Global Surgery Commission, and they had a CARAD convention, which was in place called CARAD, where they basically laid out some plans for access to surgical care in India, in rural India. This is where the research which I am doing comes in. So I'm doing a research with ASAR, which is an NGO looking at socially implementable research for policymaking. We're working with Harvard Research Group and the Duke Global Health Group. Essentially, what's happening is that there is a backlog or a predicted volume requirement of surgeries, which is impossible to solve with the current tertiary care system we have, or even if we scale up the tertiary care system, we cannot manage that backlog. So what the Lancet Commission and the CARAD Convention came to a conclusion was that you needed to have essential surgical facilities in rural India placed strategically to reduce this backlog. And they gave a certain number of procedures, what all would require, what all minimum requirements for equipment, training wise, etc. would be required, and they laid it down. The problem was that they gave a very generic idea or a template for a country to follow, which is an insanely large administrative and a logistical issue. So there had been no study which sort of looked at how you would go about implementing this change. That is where we come in. And what we essentially did is that there is a paper by Ologunde, and there's some pioneering research by Rose et al. And Prem Kumar in Tanzania. What all of these people did is that they used the Lancet Global Surgery Commission model, which is essentially based on 4 things. So essentially, if a person in rural India needs to have access to surgical care, they need to have 4 things available. First of all, the surgical care center needs to be accessible to that person. So that is defined as they need to be able to reach that place within 2 hours from their start location. The second is that place, that hospital, needs to have the capacity to do that essential surgery. Third would be that if they are able to get that surgery from that place, that surgery does not lead them to have catastrophic health expenditure, which is basically them spending more than 10% of their annual income, which can destabilize the finances of any family. And lastly, there should be the surgeries which are performed at those centers need to be at a particular level of safety set out by the WHO. If all these criteria are fulfilled, then all the people who fall into this category where they have access to all of these things at one facility would be considered as having proper surgical care. Now, using this model, this is a very complex, you have to manually clean geocoordinates of like 30,000 healthcare facilities across India, which are providing healthcare, surgical care. You have to pinpoint them by geolocation, stuff like that. And putting all of that together using probability subsets, we are trying to come up with a cluster map where we are showing the areas of deficit and essentially trying to suggest to the government that, look, if you set out this much as a budget, then proportionally, these are the essential places where you should place these facilities with these minimum equipment to have the largest impact, largest positive impact on patient care in terms of surgical care for the population of rural India. Now, if you look at it, this research is insanely impactful to almost everybody who doesn't currently have access to surgical care. And we need more research like this, because moving forward, the government is opening up to NGOs and studies, basically research proven data to decide where they invest in infrastructure, because the government does not have an unlimited amount of money. So this is where there is a sort of an intersection between policy, research, and sort of economics. And I think it's a very new and upcoming field in research, particularly in India, because it's not been done before. And a lot of, like Shirish said, there's a lot of healthcare groups from Western countries who are aware of this problem, are working on it, but we are the ones who are geographically blessed to be in a lower and middle income country and have access to it. So they want to collaborate with us. It's a huge opportunity for people who want to get into policy or make an actual real world, possibly feel like you've made a genuine impact rather than, comparatively not seeing the results very soon if you do clinical research. So I definitely suggest people to look into research in rural surgery, because quite often you do not have to go anywhere. You can sit at home, take government data, work with a group, and solve questions which are crucial for the government and the people. So it's a very interesting field coming up. Is there any questions per se that I can keep talking about what we're doing, the research for us?
Tanmay, I guess we are short of time and
No,
like
yeah, absolutely. I think
and
I have.
questions per se, I guess we both can keep on speaking on this topic and more and more. And like this whole topic of research can go on for like hours and this will never end. If Varun has a comment, he can address it right now. Yeah, Varun.
Right. So I would just like to add on to what Tanmay said, and he just shared a very important lesson. All right, for everyone who's venturing into research from at a very young stage right now, that don't do it for your CVs and portfolios only. All right, take it up actively if you're really interested in it, and the ultimate aim out of it is that you want to make a change. All right, if you're writing, if you're doing it to get a publication out of it, then don't do it again and again. All right, because it really dilutes the fun out of it. All right, and yes, the basic satisfaction that you get out of it, because as you would have realized, it takes a lot of time and effort and discipline to do the same thing again and again for years, is that not all right if you're not doing stuff that would give rise to ideas that would ultimately help improve patient care in the future, all right, then don't do it. All right, it's not going to benefit you, and neither it's going to benefit anyone else. Okay, keep that in mind.
Yeah. So yeah, thank you so much, Varun. Thank you so much, Tanmay, and thank you so much, Sonika ma'am. So I guess we can conclude with the panel discussion now. And on a personal note, I would like to share a few lessons and a few things that I would like to summarize on the whole discussion that we went through. I guess there wasn't a point that we didn't touch upon that was related to surgery and research, like right from why it is needed to like each and every kind of research that could be taken up as a surgical project, like right from the most basic case reports to like unorthodox kind of projects like audits and clinical research, translational research, basic research, like what goes on in tertiary care centers, what goes on in rural areas, what is the scope of it internationally, what can you do, what do the others do. Like I guess there wasn't anything that we we felt was left out. And like I was really glad that we had such an intellectual discussion and such a lot of food for thought that we generated for this panel discussion. And I'm really thankful to all the panelists who are like kind of very inspiring to our delegates who are like still very young. Like one of them is an intern, two of them are residents, and still they are speaking so boldly about research and policy change impacting the current evidence, impacting the current practice, impacting the current health system. So looking at it from an undergraduate perspective, we only can inspire more on taking up things into considerations. Ki no, there is a lot more to medicine and healthcare than just the academics that we are on, just the rat race that we follow and just give the need or like uh, pass out to a residency. And there's a lot more to it. And there's the other side to it as well. Ki like if you are genuinely like research is something that takes out a lot of time, effort, and if you put out your passion into it, it will definitely take out results. It will definitely yield results to you. But yeah, it is not something that everyone should compulsorily take up, but it is desirable for everyone to at least have knowledge on like how to at least read journal papers and like bring out evidence into your practice to the extent that you would like to. So on that extent, I would like to thank like all the panelists again. I would like to thank the entire organizing committee of Icon Surgery for providing Research Unit of Clinicis the opportunity to hold a panel discussion on research in surgery in this conference, and Clinicis for organizing this very amazing conference. Thank you so much. And I guess there are no doubts from the delegates yet. And actually, we are short of time. So we can, like, we'll be giving the feedback form. You can put out your doubts there. all the panelists may share their emails also later, and you can get in touch with them again. And we'll be giving the huge entire link of whatever the panelists have spoken about this organization, that organization, and all in a single message, and then you can surf through them. So that's it for today evening. Thank you so much.
Thank you for being such a kind audience. This is
Thanks,
really
Shirish.
very
I'm pretty sure you're going to be on
thanks,
the other side of
Shirish, for
the panel
having
discussion
us
very, very
be a
soon,
part of this.
blowing us
Thank you
out of the
so much.
water.
Thank you so much, Tanvira.
Thank you so much.
Okay. Hello. So we'll be starting with a closing ceremony for Icon Surgery 2021. So we have Rashika and Anna, the international chairperson and international coordinator from Ukraine. So delegates are requested to not leave this call. We just require the next 20 minutes of your time. So over to you, Rashika and Anna. Anna is here. Okay, where is Rashika?
One second. Shivani, will you share the PPT?
Okay, I'll share it. Just give me a minute.
One sec.
Okay, is my screen visible?
Yes, yes, it's visible.
So can we start?
Yes, okay. Hi, everyone. My name is Anna Maria George. I am the International Coordinator of CCE.
Hi all, I'm Rashika Khemka. I am the International Chairperson for Ukraine.
We are indeed honored to lead the closing ceremony of Icon Surgery 2021. As we come to the end of our conference, let us reminisce about the events of the past 3 days.
On day one, we We commenced with the inaugural ceremony. We began with an introduction to Icon Surgery 2021, its objectives and how we would go about it in the upcoming days. We were highly privileged to collaborate with some of the most esteemed and dedicated promotional partners. Each of the partners gave an overview of their respective organization. Each organization spoke about what they are striving to achieve and what they stand for. You can find their Instagram handles in the respective in the respective slide. This was followed by a basic surgical asepsis webinar by a highly skilled orthopedic surgeon, Dr. Krunal Soni. It was definitely an intense, interactive and educational session.
Day 2 began with an advanced suture skill workshop led by Dr. Krunal Soni. We bet it was one of the most needed workshops for the delegates aspiring for surgery. Next, we had an enlightening panel discussion with our esteemed panel members on the scope of surgery in India and abroad. We hope that most of the queries that the delegates had were answered in a gratifying and systematic manner. Next, third day, the main event of day 3 was the surgical research program by the research unit of CCE. It was a panel discussion on how to conduct research in surgery. I think I speak for all when I say that it was pretty amazing. We hope that it was quite informative and was worth attending.
So the winners for the webinar were, first winner was Prakriti, the second winner was Peter, Bhavya and Tamulina. The winners for the suture, the first winner was Mrunal, Parul and Dhanushi. So now let's move on to the vote of thanks. We would like to begin by thanking all the eminent surgeons who took the time out from their busy schedules and honored us with their presence. We thank our national panel members, Dr. Raja Vignesh, Dr. Chintamani, Dr. Hemika Gupta, Dr. Sunil Keswani, Dr. Poonam Jain, Dr. Deepak Napare, Dr. Sharad Desai and Dr. Pranshu Mehta for sharing their insightful opinions and also their personal experiences.
Next, we thank our international panelists, Dr. Kravets Kostiantin Vladimirovich, Dr. Manikantan Kathirvel, Dr. Manjula Rajkumar, Dr. Sanjeev Majumdar, and Dr. Chandrika Mugandan for their diligently sharing their perspectives. We extend our sincere gratitude to the panelists. We would also like to express our gratitude towards Dr. Krunal Soni, our Senior Executive Officer, Dr. Abhineet Desai, and Dr. Tanya Manish Arikat, our Junior Executive Officers of PD Wing, for their crucial role in making this event a grand success. I request Dr. Krunal to say a few words.
Dr. Krunal Soni has not joined in, I guess, because I can't see him in the room. So you can go ahead.
Okay, so also a sincere thanks to the stream ambassador, Dr. Arzu Salia. We also appreciate the time and support given by our national officers Avantika Singh, Gayas Khan, Fozia Sheikh, and Sara Saxena. We are greatly indebted to Dr. Varun Sarodya, the international chairperson for UK, for approaching several panelists. We thank Sakshi for the international chairperson for Italy for her support. And also we thank Aryan Shivaraj, the international chairperson for Philippines, for actively participating.
Heartfelt gratitude to our college representatives, Saranya Gopinath and Ritrima Baidya. A special mention to Dr. Kshitij Badade and Mahima Kumari. A profound gratitude towards the founder and director of CCE, Shivani Gulab, who has been our backbone throughout the event. Thank you for guiding us for making this event a resounding success. We are sure that everyone would like to hear a few words from you.
Thank you so much, Anna and Rashika. I would like to sincerely extend my warm thanks and gratitude towards everyone who came together. And here we are at the end of this conference in the concluding Icon Surgery 2021. It was a phenomenal journey and ecstatic, and we were sometimes anxious, we were sometimes ahead of our schedules and we were ready, but it was a journey in itself. So it was a really different experience. And I hope the delegates also enjoyed this experience and had something to learn from this Icon Surgery 2021. I hope we stood by our objective and we have fulfilled and satisfied all the aim and objective of Icon Surgery 2021, which was to give a very detailed perspective and insight in surgery, not just academically, but this was more of a professionally and commercially oriented conference to know what lies ahead and whether surgery is for us or no, and also to put a major spotlight on surgical research program, because that is research has always been neglected, and it's high time we take it in. We accept that it's a really important and integral part of our training. And thank you so much for the amazing panel discussion, the researchers today who had joined us, and even the speakers and panelists and faculties from India as well as abroad. So to summarize this, in the end, I would definitely want to thank Dr. Krunal Soni, Dr. Tanya, and Dr. Abhineet for being the pillars and the leaders of this Icon Surgery 2021. And I'm just overwhelmed right now. I don't have anything else to say. I'm just really thankful. Hopefully we'll do more such conferences, and we'll bring more such opportunities for Clinicase members and even students, medical students and doctors all across India and all across the globe. So that's it from my side. Thank you, everyone. My sincere gratitude towards everyone. Thank you so much.
Thank you so much, Shivani. We are grateful to have the most benevolent organizations by our side who promoted us in the best possible way. Thanks again for recognizing our cause and being a helping hand throughout. We look forward to work with you in the near future. The promotional partners were BIMA, Aspire, SNO Karnataka, Medusane, GCMER, IMA MSN Karnataka, Doctors for a Cause, SMR, IFMS, BIMCO, Students Against COVID, AGAM, and SSID. We were fortunate enough to have a wonderful set of delegates. On behalf of all the members of CCE, we would like to thank you for your enthusiasm and dynamic participation throughout the event. A mail consisting of a toolkit will be sent to all the delegates. The toolkit will include 3 certificates for the basic surgical asepsis webinar, for the advanced suture skills, and also a delegation certificate. For the Icon Surgery 2021. In addition to the certificates, there will be a video of our memories together, and we have also the recordings of all the workshops and webinars. Kindly do not leave the WhatsApp group until we have ensured the delegates have received their respective certificates and toolkits. The entire event will be uploaded on YouTube later in the CCE channel. We hope to see you in the upcoming events. Thank you so much.
Thank you, everyone. We would like to conclude Icon Surgery 2021 here. It was great meeting everyone. Hopefully, we'll see you next year. And please do participate in the events and workshops and webinars and the many, many opportunities that Clinicase is always trying to provide you with. Thank you so much. You guys can leave the meeting and we'll end the meeting. Thank you.